Hey guys, this is Dr. Zach Rourk. Today on the podcast, we're going to talk about hockey hip mobility. So, specifically for a hockey player, what are the best methods, best strategies to improve your mobility? And then, what are the things that a lot of hockey players are doing right now that you should stay away from? Because one, they're not going to help you too much with your hip mobility, and two, they set you up for long term problems down the road. The better that you understand the actual root cause of a limitation in mobility, the better you're going to understand how to deal with it. Okay, so today we're going to talk about hip mobility for hockey players. And this is a topic that I talk to a lot of my athletes about in the gym. And a lot of it actually comes from me telling them to stop what you're doing, stop trying to improve your hip mobility. And so today, what we'll talk about is first, what's the difference between mobility and flexibility? I did a podcast a little while ago on flexibility, but this one will be a lot more specific and tight to hip mobility for hockey players. And then we want to talk about how trainable is hip mobility? How much could you affect? And then what are the risks associated with hip mobility, training for hip mobility? Kind of what are the pros and cons? And then what would be the best way to go about approaching it? Okay, so first thing is mobility versus flexibility. Mobility is the ability of a joint to move through its full range of motion. Mobility, when it comes to hip mobility, is how good are you at abducting, adducting, internally rotating, externally rotating, flexing, extending, and circumducting. Those are all the movements of the hip. And so um, mobility is basically like what's the function of the joint like? Where flexibility, you could think of that as how stretchy is a particular muscle or muscle group. Okay, so how much could you stretch your quad muscle group? How much could you stretch your hip flexors or your glute med or your glute max? And so flexibility is almost looking at like one component of mobility, because a way you could think about it is if you look at the flexibility of all the different muscles around a joint, then you would have some kind of inference into what the mobility of that joint will be like. Okay, so that's the difference between mobility and flexibility. And we talked before about how flexibility, if you stretch, here's just a quick summary on flexibility. If you stretch, um, you'll get an acute response. And the acute response will be that you'll have more flexibility of whatever muscle group it is you just stretched. Um, that'll last for like 1 to 4 hours. You'll also have in theory, an increased risk of injury if you're going to do some kind of explosive power type of work. And I would say that that's definitely in theory. It's really hard to study that because injuries don't happen super frequently. But there's a strong mechanism to give us evidence that there'd be that increased risk. Um, and there's about a 15-minute washout period. So you're kind of like after you stretch, you have about a 15-minute washout period where there's a strong chance you have an increased risk of injury. And then after that, you get another 45 minutes to, what would that be? 3 hours and 45 minutes of increased flexibility of that muscle group. And we talked in that other podcast about how you can use it to your advantage and how you can use some timing in your warm up and that kind of stuff. Okay, so that's flexibility. For long-term changes in flexibility, the amount of stretching you have to do is a lot, a lot. It's like 4 to 5 times a day for sessions of 30 to 60 minutes. And most people just don't do that kind of thing. There are some sports where it's common to do that kind of thing, like some dance disciplines, gymnastics, that kind of thing. Anyway, so that's flexibility. Mobility is different in that what we care about is not how stretchy is a muscle or a muscle group. It's what we care about is what's the range of motion of the joint. Okay. Now, we talked about how flexibility, you could say, if you knew the flexibility of all the muscles around a joint, that would help you to have it to to venture a guess about the mobility of the joint. But it wouldn't tell you for sure. And it wouldn't tell you for sure because the mobility of a joint is not only dependent on the flexibility of the muscles around it. Okay? So there are one of the, well, I guess we can just get into it here. So a lot of hockey players will say that they're not flexible enough, which is a misuse of terms. What they usually mean is that they don't have enough mobility in their hips. A lot of hockey players will say they want more mobility in their hips so that they can skate better. And um, so we'd have to look at what are the causes of lack of mobility. And one of them could be a flexibility issue. You know, I have muscles that are too tight, and so those are restricting movement of my hips. I can tell you from experience, very rarely is that the cause of a lack of mobility for hockey players. Another one, which is a bummer, is you can have an anatomical issue or a hard structural issue. So that would be like the shape of your femoral head. That's like the ball that goes into the socket in your hip. The shape of that ball and the shape of the socket, they just don't allow for really great ranges of motion through abduction or adduction or internal rotation, whatever it may be. Um, and I've seen that a lot actually in hockey players. Um, it just so happens that not everyone's hips are built uh, to have the types of mobility that you would normally expect in a hockey player. Now, that doesn't mean you can't be successful in hockey. I've seen that in really high level NHL athletes. They just don't have the same hip mobility as everyone else, and they come up with different strategies to get around that. Okay, so we have flexibility could be an issue. It's not very common. Mobility, structural setup could be an issue, and that's pretty common. And that we'll get to that in a minute. That's a big reason that I'm doing this podcast. And then the third reason, which is kind of like the most hopeful reason, is you have muscular imbalance about the hip. So the imbalance isn't necessarily a flexibility imbalance. Usually the roots of the imbalance are a strength imbalance. And the strength imbalance leads to limitations in flexibility. And so it's maybe like getting to the root cause a little bit better of mobility issues. So the first one, flexibility. The a way to address that would be to stretch, 5-6 times a week. Um, I'm sorry, 4 to 6 times a day over the course of a long period of time. Most people aren't going to do that, and it's really not a practical solution. The second one, if you have an anatomical structural issue, the only real fix there is surgery. And some people are candidates for surgery in that respect, and some people aren't. But if you have a structural issue, there's really not anything that can be done. Um, and if you try, you will actually run into more problems down the road. And then the imbalance issue, that's where I said that was like the most promising. That's where we can actually make some big differences. And typically for a hockey player, so we'll address the imbalance one because that's the easiest one to deal with. For a hockey player, typically if you like what you're learning here, you're going to love our free Hockey Hips protocol. It's the same protocol that I've developed over the last 10 years. I use it with all my pros. It's designed to maximize the performance of your hips, to maximize the performance on ice, and to reduce your injury risk on ice. If you want this free protocol, visit us at perfectworldhockey.com/remote training. Imbalance is that they're quad dominant. So, it's probably more fair to say they're anterior chain dominant, which just means that the muscles on the front side of their body are dominant compared to the muscles on their back side of their body. And where we see this the most is in your quads and in your rec fem and in your TFL. So those three sort of muscle groups are going to be the most dominant muscle groups that you have. And the groups that are passive or our weak are going to be your glute max and your glute med, and then your deep lateral rotators. So those are like the muscles on the back and the side of your hip. It's not uncommon for you to also have a weak adductor group. So it's kind of like the front of your leg is trying to do all the work, and the back of your leg and the sides of your leg aren't really pulling their weight. Okay. Really common in hockey players, really common in all athletes. I've worked with over 50 different sports at the Division I, Division III level and above, and pretty much all athletes are going to have some kind of quad dominant patterning. So if you have this quad dominant pattern, what you'll do is you'll start to create imbalances around the hip. Those imbalances in strength will lead to imbalances in flexibility, which will lead to imbalances in mobility. And so what we can do as a fix, instead of just stretching, which sometimes it's useful to stretch, because what's going to happen are the muscles on the front side, your quads, your rec fem, your TFL, those are going to get tight. Okay. They're overworked and they shorten. And then the muscles on the back side are going to be extra lengthened and they're going to be weak. So they're long and weak on the back, short and tight on the front. And so sometimes it's useful to stretch the front, but the main goal, the most important part, is to strengthen everything on the backside. And that's strengthen your glute max, strengthen your glute med, strengthen your deep lateral rotators. And if you do that, what you do is you start to balance the joint. And when you balance the joint, then you unlock the mobility of the joint. Okay? So sometimes you can use stretching. So that would be like a flexibility method. Sometimes you can use that to your advantage. And what you're really using it for is you want to open up the front of your hip so that you can access the muscles of extension, or your glute max, basically. But if your focus is on stretching, you're really never going to get there. You'll have these short-term effects. You'll have these short-term windows where you'll see improvement, and then it'll go away, right? So the real focus, if you want to improve mobility of your hips for hockey, is you want to strengthen all the other muscle groups that are non-dominant. So that's, like I said, adductor group, glute max, glute med, deep lateral rotators of the hip. If you can work on those, then it like frees your hip. And that's what we work on at the gym quite a bit. We actually have a free program that we offer. If you want to download it, it's at perfectworldhockey.com/remote training. But there's a free program that you can download, and it works on all of that musculature. We start that program by doing a little bit of flexibility on the front of the hip, and then everything after that is about strengthening the backside of the hip, activating the backside of the hip, and it's incredibly effective. I think it's about a 12-minute protocol. I recommend doing it every day. So that's the easiest one. That's the one that you want to approach. If you're a hockey player, that's kind of the approach I'd recommend you take. There's a problem that I see all the time, and this is hockey players trying to stretch themselves into good hip mobility. So the biggest one that I see are 90-90s. And I don't let anyone do 90-90s in my gym. And the reason for that is, if you just ask your hip to give you more mobility than it can in a stretch position, it won't be able to. It won't be able to. And so when it isn't able to give you the mobility that you need, then you have to steal it from other places. And almost always, you're going to steal it from your lumbar spine. And if you watch people do those 90-90s, people that don't have great hip mobility, what you'll see is that they put an incredible amount of stress on their lumbar spine, on the discs especially in their lumbar spine. And if you do that long enough, over and over and over, it starts to degrade the discs, and then it leads to some kind of bulge or herniation or some kind of problem down the line. And we don't want to see that, obviously. So No 90-90s. There's a lot of these like slow, extreme range of motion type of drills. You'll see players where they're standing on one leg and then they're trying to articulate their hip in these extreme ranges of motion. And again, what happens is they ask for more range of motion than their hip can provide. And when they do that, they have to steal it from somewhere else. And the place that they steal it from is going to be typically their lumbar spine. And so for me, I'm never willing to sacrifice your spine for hip mobility, especially because it's not very effective, right? Now, a lot of players think that it feels really good, and it feels really good to them because uh, they're sore in the areas that they're trying to work, right? So their hips get sore from it. That's not necessary. That doesn't necessarily mean it's working, and in my opinion, it's not working. Um, and so I would just really stress that it's not a good idea to attack hip mobility by doing these sort of like excessive end range of motion stretches. Because what you'll find at that end range of motion is you're stealing from your spine or you're banging into your labrum. And the labrum is like the little lip that surrounds the socket. And what you can do if you keep on stretching to end range of motion is you'll have the femoral neck will actually bang into the labrum. And I mean, most any hockey player is going to have a labral tear if they play long enough, but we don't need to speed that process up. And we don't need to irritate a labral tear by doing excessive stretching. And so I guess the main takeaway here is if you want to improve your hip mobility, stretching is not the route. Okay? If you want to improve your hip mobility, you need to attack the root cause. And the root cause is going to be the balance of muscles around the hip. And so if you go about that correctly, what you'll do is you'll strengthen the muscles on the backside, your glute. You'll strengthen the muscles on the sides, your glute med and your adductors. And then you'll strengthen your lateral rotators, which are like the deeper muscles on the backside of your hip. And if you do that, you restore function to the joint and it can move. On the other hand, if you just keep trying to wrench on your hips and you keep trying to stretch them excessively into extreme ranges of motion, you'll degrade the tissues around the hip. So that's what leads to labral tears in part. And you can degrade the neighboring joints, which would be like the joints of your lumbar spine. So stop doing 90-90s. Stop doing these excessive hip stretching programs and work on your glutes. And again, if you want a free program that addresses all of these things, you can go to perfectworldhockey.com/remote training and you can download that free program. It's actually an app that you'll get on your phone. There's videos of how to do all the exercises. There's time, sets, reps, everything. And it's like a 10 to 12 minute protocol that you can run through. And I tell all my athletes, just do it every day until you die. Do it every day until you die, and it'll be super helpful in improving your performance and reducing risk of any lower back injury. All right, that's what I have for you today. Hopefully that was helpful. This has been a presentation of the PWHT Podcast. If you like what you heard here, you're going to love training with us. If you live near Edina, Minnesota, schedule a consultation with us at perfectworldhockey.com/consultation. If you don't live near us and you can't train in person, you're still in luck. Go to perfectworldhockey.com/remote training to download our app. That way you can do all the same training that we do in our gym at your gym at home.